Hey guys, and welcome to part 3 of 3 in how I treat TMJD. In part 1, I went over the examination and diagnostic process. In part 2, I went over the 4 different levels of treatment that I have at my office, with 4 being the highest. That's like a locked jaw. Level 1 is just very, very few symptoms. Every now and then clicking and popping, every now and then some jaw pain, and levels 2 and 3 are in between those two. Now I'm going to go over exactly how I treat. So for every single patient of mine, I make a daytime and a nighttime orthotic. We measure where the muscles are the most relaxed and where the joints are aligned. And we build a daytime and nighttime orthotic that hold the jaw in a very specific position. Our goal is to taper our patients off of the daytime orthotic, usually within 12 to 16 weeks. So it's not something that we want people wearing forever. Most people choose to wear the nighttime one indefinitely because it kind of keeps them out of trouble, keeps the jaw joint and the jaw muscles nice and healthy. In addition to making these orthotics, we see our patients every 1 to 2 weeks, depending on the severity of their TMJ condition. At these appointments, we do myofascial release, we do craniosacral therapy, we specifically release some muscles inside the mouth, and we do osteopathic manual jaw manipulation. All of those are super important, and at the end of all of that, at each appointment, we then check the orthotics because they cannot change, but each individual can. And as the muscles and the joints return to health and function, we have to be adjusting the orthotics as we go along to support and keep up with the body's changes. So as our patients get better and better, we see them every 3 weeks, every 4, every 5, until we can release them from active treatment. Typically, patients are in treatment anywhere from 4 to 7 months. Some people kind of fly through it and they're done within 3 months. Other people, it takes longer than 7 months, just depending, again, on the severity of the condition and how quickly everybody's body responds. So that's sort of what's involved. Typically, we see pain go down pretty drastically within a month, month and a half. Clicking and popping can take 4 to 6 months. It's just sort of a slower process. So that's how I treat TMJD. I hope that this 3-part series helped clarify things for you. In the caption below, I've linked parts 1 and part 2, so it's easy. You don't have to search for anything. If you want to, you can take a look at my playlist. There's also a playlist called How I Treat TMJD. So check that out for sure. Be sure to follow. So much more to come. Thanks, guys.